I have a strong family history of breast cancer and ovarian cancer. My sister and I have both had genetic testing and carry the same BRCA1 and 2 mutation. I'm scheduled for MRIs and mammograms, and I've also had a complete hysterectomy. Am I doing enough?
When somebody has a gene mutation, we take many different steps. One, as you're doing, we take steps for screening and early detection. So MRI is actually a better screening technique in patients who have a gene mutation. So usually we talk about doing an MRI once a year and probably alternate that with mammogram in between. And then, of course, make sure you see a physician who does a physician examination. And then, of course, you should continue to do self-breast examination. So those are the so-called screening strategies. And then you said you had hysterectomy, and make sure you had oophorectomy, means removal of both ovaries and the tubes along with the uterus. So that's extremely important. By removing the ovaries and the tubes, you prevent the chance of developing ovarian cancer, 80 to 90%. And by removing the ovaries by itself, you can cut down the risk of breast cancer by 50 to 60%. So then let's just say if you want to go for a little more radical, again, it depends on how old you are and what stage of your life. In some patients, we talk about removing both breasts, the so-called bilateral mastectomy. Again, that's a very personal choice. So those are probably the steps. But make sure you continue to talk to your oncologist or your high-risk breast clinic doctor, and make sure you follow other recommendations for screening too, like the colon cancer screening and other screening as recommended by your doctor. And again, we don't have enough data, but lifestyle is an extremely important in breast cancer prevention. And that's clearly proven. Exercise and diet, avoiding smoking and alcohol, those things can cut down the chance of breast cancer. So we think in patients who have a mutation, potentially that can play a role too.